from Microbe TV. This is Q&A with A&V. I'm Vincent Racaniello, and joining me tonight from Chevy Chase, Maryland, Amy Rosenfeld. Hey, Amy.
Hi, Vincent. How are you today?
I'm pretty well. How are you?
I'm fine.
You okay? You okay?
Yeah, I'm fine.
Work is good?
Yeah, I printed my first poster. I have my first structure. Hired my first person. Yeah,
This is all
it's
good.
fine.
Very exciting. Very good. Well,
Yeah.
I am happy to tell everyone that last week at ASTMH, both Dixon and I got infected. Well, not happy to tell, but
I was going
Dixon,
to say, I don't know that I would use the word happy. I
I'm
would
not
just
happy.
say
Well,
Dixon
we're
was
both
definitely not happy since it was his second roundabout.
So Dixon called me on Wednesday morning in Seattle. I just got in the night before. He said, Vincent, I'm positive. Give me Daniel's number. So I gave it to him, and Daniel got him Paxlovid. And the next day we both returned. I never saw Dixon there, actually. And then on Friday, if you listen to Twiv, I was snorting and clearing throat a bit. And Saturday it got a bit worse, so tested positive. And Daniel got me Paxlovid, and I am finishing the Paxlovid. I have one more course tomorrow morning, and that's it. But the symptoms in the 24 hours really diminished. So there you go. It had to happen eventually. I'm traveling all over the place, and I figure, yeah, there you go.
Well,
I'm good.
not
The only
only
thing
that,
is this: I got this weird taste in my mouth. It's kind of pain, but it's fine. I've been doing a lot of stuff. I did 3 hours of lecture today at Columbia. Been doing podcasts and everything. Sorry, Amy, what were you going to say? Go ahead.
well, I mean, it's not like you had severe symptoms to begin with.
It felt like a flu. Okay, so someone says I should have gotten that booster. Okay, Dixon had the bivalent booster 2 weeks before he got infected. So much for that.
Well, he didn't develop disease, so what's the point?
He had symptomatic. He had symptoms. Yeah, he was hacking and sneezing, and yeah. I mean, it wasn't severe, but who knows how far it would have gone. I mean, that's one thing. Jake Scott said, I asked Jake Scott last Friday, and he said, I wouldn't treat you. But Daniel said, yeah, you have to be treated. And Dixon for sure, because he has multiple morbidities anyway. And anyway, Dixon's fine, and I'm fine, as you can see. There ain't
Oh,
gonna
really?
be
That's
no
not a second head coming off your shoulder?
from the Paxlovid. This is a sweater because it's cold in the house. So I had a little. Now it's winter. I really wanted to try no treatment, but Daniel said, nah, you should treat yourself. So here we are. And Amy is now the only one tonight that on this Q&A of two hosts who hasn't had COVID, right?
Yeah. I'm sure at some point I'll be infected. I'll be fine.
Well, if you need Paxlovid, just, you have Daniel's phone number, so there you go.
Yeah, I text you guys papers all the time.
I want to show a few photos from my trip, 3 weeks away. I'm glad to be back. Here's one. Here are the ladies in Hawaii. That's
Cindy, Steph, and Brianne.
And Brianne. We had lunch outside one day here, just before the pod, actually.
So is this some kind of Hawaiian dish?
No, it's sushi.
Oh,
There's the supermarket here. We went in and bought sushi. We ate it outside, and I had asked some lady to take our picture. So that's cool. And then we have, this is the actual pod. So these were our two guests, Musa and Julia. And you can just kind of see, she has residual scarring, but she's just lovely. She's a very, very nice person. And this was all the setup that I did. And then we have, this is Lost Laboratory, who I met in Seattle for dinner. And Amy says, I look scared here. I was trying to figure out where to look. And what else do we have here? Oh, this is a shot from ASTMH. Daniel hired a photographer to roam around and take our pictures. Of course,
well, it's not just Daniel and Christine, right?
Christina, Naula, and Daniel, and me, of course. And then finally, I went to Mount Sinai in between Hawaii and Seattle on a Monday evening to give a talk in the department. And it was Halloween, of course. And this is Eva, who's a student in Anna Fernandez Sesma's lab. And I thought these things were cute. And this is Adolfo Garcia Sastre in the back there, right, Amy?
Yeah, but I forget who he's talking to.
I don't remember who that is, yeah. Anyway, so it turns out that Eva had caught a T-shirt at a live TWIV at an ASM some years ago. And so now we are back, and I'm happy to be here with everyone. So welcome, everyone. And just to remind everyone, the Spike promo has been extended through the end of the year, the Spike shirt. Matt at Vaccinated is very kind to do that. So keep buying Spike shirts for the holidays. That would be fun. And we don't welcome our moderators tonight. We have a full house. We have Vanity, we have Les, we have Frank, we have Steph. No Tom tonight. Tom is taking care of his 98-year-old mother, I believe, in Madison, Wisconsin. Okie dokie. Apparently we have some hurricane going on, so Nebby is going to lose power. So I hope you're okay. And all right, Tess asks, has anyone compared COVID rates in children when school was open versus closed? Yes, actually, the rates go up when school's open, right? They went up this fall because that's how you spread infectious diseases, right, Amy?
Yes.
What do you got on there? You have a Spike shirt?
Yes.
Is there something on it on top? Is there a sweater? That's beautiful.
I just have Spike shirt.
That's nice. I like that.
It's good.
So anyway, Tess, yes, the rates have gone up because kids are together as opposed to being at home. They're less likely, so they do go up, yeah. But, now we have, for certain ages, vaccines and drugs, so.
For all ages, we have vaccines and drugs.
So from how far down in age can we vaccinate and drug everyone?
6 months.
Okay. So we did a TWIVO this week also about genetic determinants of Black Plague. And Pete was there, and he apparently was in a lot of the digs that they were talking about, archaeology digs. So that's pretty cool, Pete. Thanks for chiming in. Virotyro says A&V is exceptional. Thank you, Virotyro. Great name, don't you think, Amy?
Yeah.
All right, so Pete says, in the 1970s, I worked on a 4th century Roman cemetery in Dorset, south of England, and the 1,200 bone sample is in the Natural History Museum. Today, they remain a resource for research never thought of back then. That's why museums are great in Park, right? You can go get samples that were collected many years ago. You know what comes to mind, Amy, when they collected pelts of koalas in many parts of the world, and you can go back to them from the 1800s and see that there is already koala retrovirus in them.
What do you mean already? It's like 200 years ago. It's been there for like thousands.
It hasn't been there for thousands, no. Hundreds. And in the 1880s confirmed it was at least that old. Yeah. Not thousands, no. Nope. Hello, Barb Mack. A rare nocturnal visit from me, nearly 1 a.m. in the UK. Welcome. Barb was at the TWIVO the other day, too. Good to see you again.
Cool.
Jenster wants T-cell information. Amy, do you have any
T-cell
new
information on what?
What would you like?
I don't know.
Someone says the font is too small. Let's make it bigger. So I ran into a lady who works with Shane Crotty and Alex Sete.
Daniela?
Daniela. Yeah, what's her last name? Do you know?
I don't know. I think it starts with a W.
Daniela Scripps Immunology. I ran into her. It's not working. My magic isn't working. Daniela Weisskopf. There you go.
What do you mean your magic isn't working? You just got to wait for Google to vomit some crap out. It's not rocket
I had to go down.
science.
I had to go down a bit on the page. I was impatient.
Well, unfortunately, she might not be the first Daniela at Scripps. It's fine.
No, but anyway, I ran into her at ASTMH,
Cool.
and I said, "Hey, will you do all the work? Why don't we get you on TWIV?" She said, "Sure, I'd love to." So I have to remember to contact her. I don't have my notebook. What do you call that thing? Field notes. It's upstairs in my backpack. So I have to remember. Make a sticky, Les, or whoever's doing stickies. Contact Daniela Weisskopf. Get her on TWIV. So Debunk the Funk is coming on. I finally got in touch with him.
Cool.
So he's coming on TWIV. I also emailed Malcolm Gladwell's agent, but they didn't respond. I don't know how else to get Gladwell. Maybe on TWIV I should just say, "Hey, Malcolm, since you're listening, can you contact us?"
For
right?
sure. For sure.
That's a good idea. Okie dokie. Oh, okay. And here's one I wanted to put a peek. Dunning-Kruger. This is a joke, right? Because Dunning-Kruger effect. You know about that, Amy?
Why don't you explain to everyone?
Well, I don't know it. Dunning-Kruger is a cognitive bias where people with low ability, expertise, or experience regarding a certain type of task or area tend to overestimate their ability. So you think you can do more than you really can. That's the Dunning-Kruger effect, okay?
Got it.
Anyway, I'm not going to lie. I want to get into Columbia so I can listen to Professor Racaniello in person. That's very sweet of you. I will be around for a number of years more, and I hope you get in. I'd love to meet you. Take the course, right? We can do it together. That'll be fun. So I'm starting in January, the Columbia course, and they'll be recorded and put online. Yes, sir. Or Les says, just get into YouTube. You can hear his course anytime. Yes, but he wants to be in person, right, Amy?
I would assume so.
Yeah, he wants to be in person. So, folks, I'm very grateful to see 265 of you here tonight. So give us a thumbs up if you have a chance, and maybe we'll get some more people here. And you think people are relaxing about the pandemic, Amy? You think they're feeling it's over?
Yeah, probably. How long can you talk about it?
Oh, I could talk forever, and so could you.
No,
Just
not about this crap.
Papers are coming out forever, you know that.
Yeah, but most of it's still crap.
But we've been talking about polio, we've been talking about monkeypox, shingles. There's always something else. And I think people just like being here. They like your bubbly.
I'm not bubbly.
I know.
I'm not.
Joking.
I'm not
joking.
bubbly. I'm definitely not bubbly.
What is bubbly? How would bubbly work for Amy?
Not good. I
you
don't do
try?
bubbly. No.
You can't do bubbly?
No. Don't irritate me.
Oh, come on, Amy. I'm trying to just...
No.
Oh, gosh.
No.
Hey, did we come up with a pandemic definition this week, you and I? We had a long conversation, I think, on
We had
Monday.
a long conversation about it. I don't think we came up with a pandemic definition. I think we just talked, and it was Sunday after my mom left, when they were waxing my floors in the lab so you couldn't do any work.
The only thing that keeps Amy out of the lab on any day is waxing the floors.
That's true. The buff puffer, and then they make it all
puffer?
sticky.
What is a buff?
I don't know.
A
It's
buffer.
this machine. It's this machine that buffs and puffs the floor because when it goes,
the puff part doesn't work. It's just buffing. It's not puffing it.
Yeah, it's sure as hell shiny.
Yeah, did you slip?
No.
All right, good. Which is more likely to happen, getting infected with SARS-CoV-2, running into 7-Eleven to buy a Powerball, or winning the Powerball lottery masked or unmasked? I don't know. I don't know if you win the lottery.
Clearly unmasked. If you're going in to buy, clearly if you're unmasked, you enhance the probability.
Well, I didn't wear a mask in Seattle, and that's how I got infected. If Daniel was very religious about wearing a mask. when he was talking to people, and only when we did the podcast he didn't. And he's good. Because I tell you, a lot of people were coming up to us at the booth to talk to us. And Dixon apparently was holding court, and he had lots and lots of people come up. So that's just, he should have worn a mask. So should I have. But I chose not to. And we have drugs. We have a plan. We have drugs. I don't have a booster. It's like Offit said. If you get infected, take Paxlovid. Thank you for the welcome back. Okay, Ian says, what is the belief as regards clinical evidence Omicron is far less severe than Delta as regards lung involvement? So if you listen to Twiv Friday, Jake Scott thinks it's mainly an upper tract infection. And Daniel said to me, that was pretty hard to listen to. Because Daniel, he said, I have 6 patients in the ICU right now with Omicron. And it's because it's not mild.
Well, you have to put it in perspective.
Okay, go ahead.
Right. So with all the other ones, when there is, so what defines mildness? So you have to ask what's the deal here. So if you said at the beginning you overflowed the ICU, so this is less. This is mild. You don't have 36 people in ICU and put them in different wards and different lining of the hallways. You have 6 people. You can tolerate that.
Yeah, but
you have to define what is mild.
People are vaccinated
then
now.
You have to say whether or not.
You can't do that. You can't say that anymore.
What?
Because people are vaccinated, so that's going to take out a lot of people from the ICU.
So of course I can say it depends on how you define mild.
Oh,
so his definition automatically was, I don't define mild by the disease. I define mild by the number of people who are in the ICU. Because you don't have any idea that those people would not have been in the ICU with any other variant.
It also depends on the status of those people. Let's say they were all unvaccinated, so Omicron is putting them in the ICU. It's not mild.
Well, you don't know that they would not have had more severe disease if they got beta or delta or alpha.
And these things are very hard to answer.
You can't really quantify it. So this is the problem that I have. I don't really like this quantification and comparison. You taught us never to compare virulence.
I agree with you. It is. I teach in my virology course. It's very hard, even in a laboratory, to quantify virulence. And in people, it's very difficult. Hospitalization, observations, ICU, whatever. It's very hard because everything is different. I agree with you 100%. So I think we don't know anything about virulence of any of these variants.
We don't know virulence about any disease.
Now, that's being a little oversimplified, Dr.
No,
Rosenfeld.
it's not.
We know that 30% of people die when they're infected with smallpox. Okay, that's some measure of its virulence.
It's some measure of its virulence, but it's not the whole story.
So anyway.
And you don't know if you give people vaccines or convalescent sera or monoclonal antibodies or whatever, if you would see 0 people dying of smallpox, and you don't know how fast it goes through antigenic drift.
So
right? In theory, it goes through antigenic drift less frequently because it's a DNA-based virus, right? And it has a ton of mechanisms, as Condit likes to say. It's got a slew of shit to get it into the cell so that there's no receptor, which I really don't understand at all, but whatever.
Here's my take, Dr. Rosenfeld, okay?
Okay. So are we gonna wallow in wrongness now too? I just want to know so I could be prepared.
I'm not giving you any warning.
Damn.
Here's what I view it. We have 2 views of viral virulence. We have the virologists, and there's 2 of us here tonight who argue that if you want to study viral virulence, you need to go in a lab, you need to go in animals, and that might not even tell you the story. And then we have the clinicians. Well,
it tells you about my mice. Tells you a lot about my mice.
Tells
you about disease in my mice.
Exactly.
Yeah.
So
tells you exactly what happens in Mickey and Minnie and their progeny.
Right,
it says not good or good.
Then there's the clinician's view the people in the trenches, right, taking care of patients. We have Daniel Griffin who says Omicron is not mild, and Jake Scott on the other coast says Omicron is mild, and even Paul Offit said Omicron is mild. So it really depends on a particular physician's population, patient population, and I think Daniel knows that the one at Stanford is different. He said it's a tertiary care hospital. It's different. So anyway, I think a virologist's view is very different. And that's why we always say here it's very hard to measure the virulence, and we don't believe any measures of any of them.
Well, it's the same thing as here. You take people give you botulism in your sphincter in your bladder when you have urinary incontinence. So you go into the doctor and you go and they say, how many times a day do you pee? You say, I pee 20 times a day. Yes. They say, and do you have accidents? And you say, yes. And so they give you botulism, an injection of botulism into your sphincter. Next person comes along, has exactly the same symptoms and pees exactly the same amount that you do. So they give them
BCG, not botulism.
No, they give you botulism.
Okay.
They give you Botox into your sphincter.
Okay. Are you going out of your lane?
No, I was in this lane. I know how this works.
I was in this lane. Okay, go ahead.
Yeah, this is what I did on my research. Yeah, I researched this. Okay.
So
then the people come back and they fill a questionnaire out about whether or not the injection was functional. So you have one person who comes back and says, I went from peeing 20 times to 11 times. This drug is fantastic. I love this drug. To reduce the amount of peeing I go to the bathroom. You have this other person come back. They say, I pee 11 times a day. This drug sucks.
Okay.
What do you mean, okay? Do you not understand?
Yeah, I understand, but I think we don't need to talk about this anymore, okay? I wanted to ask people a question. Amy and I had this discussion the other day. We're thinking, what's the matter?
Nothing. When you tell stories, everybody has to pay attention, and I have to respond, and then you just whatever. Go on.
I listened to your story about sphincters.
And then you're like blah blah blah. Okay, but you don't understand the point. So move on.
I understand the point. I wasn't born yesterday.
Well, okay. What is the point? It's all about perception.
Yeah, well, that's what clinical observation is. Yeah,
right. So you can't. So there's no way that you can quantify perception.
Amy and I wanted to ask you folks what you think of this idea. We're thinking of taking Q&A on the road in small theaters, small venues in big cities like Chicago, L.A., San Francisco, and seeding it with you guys so that you can ask questions, right?
They can launch the audience that's shy into asking questions.
So
it's a fundraiser.
As a fundraiser, you think it would work? Would you go? Do you think anyone would go? It would be fun to do. All right.
Oh, tons of people would love to watch you and I fight in real life. It's hysterical, apparently.
I find it extremely upsetting.
I didn't say I thought it was hysterical.
I've never met anyone who argues with me as much.
It doesn't go anyplace.
I've done it for 22. How long have I known you? 22 years?
Yeah.
So we'll see if I get a rebound. Yeah, I don't think I will.
Oh, you talked to the virus and you said don't have rebound?
Oh my gosh, I just don't feel that I have. We'll see. Okay, I'll let you know next week.
I just don't understand how anybody knows.
No, we don't know ahead of time. You're absolutely right.
I have no idea.
Dixon is doing fine. I just texted him actually, but he probably won't answer. But I last heard from him. Excuse me, a few days ago, and he said he's doing just great.
So he'll be on Twiv on Friday.
Yeah, probably.
The enthusiasm is overwhelming.
Yeah, his taste is back to normal. He doesn't have the Paxlovid crap anymore. He did say COVID is a bitch. I don't know why. I wouldn't say that because with Paxlovid, it's really reduced to
Because
nothing.
it's inconvenienced. You had to wear your at your house. You didn't go to work Monday and Tuesday.
But
So
I
it's
work
an
down here, so I
inconvenience.
still got
That's
things done, right?
right, but it's inconvenience. So he's saying it's an inconvenience. That's why he's calling it a bitch. I mean, he's just
Okay. Well, he doesn't
inconvenience.
work. He stays home all the time. So, anyway.
Well, I'm sure, like, there's other issues that I'm sure caused issues between him and Marlene. God,
What's wrong?
nothing.
Be patient, Amy. Patience is a virtue.
I am patient.
Uh-uh. Nope. Not true. Is it possible the SARS-CoV-2 spike proteins could evade the immune system?
Yeah,
Could
that's
they
what
accumulate in
antigenic is.
well, what they're saying is could they accumulate in tissues, and what dangers could spike proteins pose?
Accumulate in tissues, you mean outside the virus?
Yeah. Yeah. No, I don't think so. But I don't know what context you're talking about DGH, if an infection or a vaccine, but there's some conditions where antibody protein complexes can deposit in certain tissues, like the kidney, the glomeruli, the very fine passages there, and clog them up. But I don't know of any evidence that's happening with COVID, right? Do you know of any, Amy?
No.
But, it's not just evading the immune response. Proteins turn over. It doesn't have to be mediated by the immune response. So they do get degraded by a protein degrading machinery.
Well, they
So,
don't get degraded by the immune response. They get
no.
degraded by the proteasome or the unfolded protein response in the cell. They clog up the ER.
So if say a virus particle is taken up by an antigen presenting cell, it's degraded, right? By the proteasome.
Yeah.
And then the peptides are displayed on the cell surface, right?
Yeah.
All right. How much do you think herpes viruses contribute to HIV disease progression? I think HCV. What is HCV?
I don't know. Maybe he means capiosarcoma? Or do you think he means HSV and he just pushed the Z by mistake because it's close to the S
Yeah, but
on the keyboard?
he's got HSV2 here separately.
Oh, I
I don't
don't
know what
know
it
what
means by HCV.
HC.
Anyway, do they contribute to HIV disease progression? Yeah, I mean, certainly, because especially in an untreated AIDS patient, you're immunosuppressed, and so herpes infections are going to go crazy. I mean, cytomegalovirus was a big problem in
That was
early AIDS.
KSHV. That was.
KSHV, that one too, but the herpes viruses are going to be an issue. So yes, if you're untreated, I think they're going to be an issue, and I don't know how much, but it really depends on the patient, right?
I guess.
Ian says, "What if you get rebound? What will you do?" I'll complain here. I'll complain because I'm not going to get another course of Paxlovid. I don't think without another infection that wouldn't be indicated. I don't know what I'll do. I'll take Motrin and Tylenol. I'll let you know. I'll first ask Amy. I said, Amy, I'm feeling crappy again. What do I do? And what will Amy say?
Chicken soup.
I said to Amy the other day, I feel crappy. She said, go back to bed. I said, I'm already at the incubator. How can I go back to bed?
You weren't at the incubator. You were at home.
I don't go back to bed. Once I'm up, that's it. Do you ever go back to bed?
No.
Yeah, it's just not in my DNA.
But I also have sleep issues.
Okay.
So, like, for instance, like,
which your mother just learned, right? Apparently.
Yeah, she did. She doesn't. So she's snoring away, and I'm like roaming around, and she's like, "I don't understand how you don't go to sleep." I was like, "Well, I got into bed and I tried to go to sleep, and And then she's like, yeah, but every time I turn around, you're up out of bed. I was like, well, what can I say? That's just the
Someone's
way it works.
Oh, so someone said HZV, herpes zoster. Okay, yeah, yeah, that would be good. Herpes zoster. Yeah, I think they can all influence the disease progression. Someone said, okay, so just to bring people up to speed who came late, yes, Dixon and I both had symptomatic SARS-CoV-2 infection, aka COVID. We were both given by Daniel Paxlovid, and we're both doing well. The mother and the baby are doing well.
Who's the mother?
It's just a saying, you know, how they say the mother and the baby are doing well.
Yeah, I do. I just wanted to know. Never mind. Move on.
My first Twivish video was when you tested false positive. That's what got me interested. Yeah, that's interesting. Yeah, that was a long time ago. Amy was working with plasmids in the lab, but she doesn't believe that it was a plasmid, right? It was just a false positive, correct?
Oh, for sure. It was just a false positive. It wasn't a
because
plasmid.
I had no antibody.
Plasmid theory was totally stupid.
And
The plasmid theory was totally stupid.
And I got another test a few days later. It was negative. Yeah, but I'm glad we attracted you, Seymour. Yeah, I took advantage of it to do a video, and I thought it was a teaching moment, and it got viewed a lot. I was explaining, you know, how the PCR worked and why it could be a false positive. Maybe a good time to mention a preprint on HLA-B 1501 association with symptomatic infection.
Yeah, I sent it to you.
You did?
Yeah, months ago.
Months ago. Is it still a preprint, or has it been published?
No,
yet?
it's published in a Cell journal. It's been out for, or maybe it was Nature Immunology or something. It's one of those two. It's been out for a couple of months. I sent it to you.
So on Twivo, we did a paper where they found a SNP associated with Black Plague, right? And concomitantly, someone has found it's associated with severe COVID as well. It's quite interesting, you know, independently.
Well, I guarantee you there's going to be SNPs that are associated with all diseases that will then be associated with another set of all diseases.
Mm-hmm.
I mean, this is not surprising. I bet you it's in the innate immune response or somewhere around there.
So interestingly, the allele they found in the Black Plague story, the protective allele is associated with a higher rate of inflammatory bowel disease. So, you know, the immune system is balanced. If you unbalance it, things can happen. Is it shocking, Amy?
Yeah, luckily I'm sitting down because I might hurt myself from this unexpected result that I could have predicted 2 years ago. Yeah, shocking.
So the way Amy delivers that, it's a good thing I'm sitting. What is that delivery called? Do you know what the word for it is?
Very monotoned?
Yeah, somebody was famous for that kind of thing, no?
Yes. A comedian was very famous for it, being monotone and subdued.
Who's that?
I don't know. I forgot.
All right, okay.
But yes, but I mean, seriously, if you told me that the TLR3 mutations that Casanova has identified for herpes were related to, you know, MERS, I wouldn't be that surprised.
Okay. So we got some words here. Sassy, deadpan, sarcasm.
Well, it's not sassy. It's definitely not sassy. It's deadpan.
Yeah. You're deadpan, Dr. Rosenfeld.
Yeah, well, what are you, the straight man?
I call Amy's type of shocking delivery deadpan.
Yes. Are you the straight man?
Can be.
I don't know. What are you in this?
I'm the foil. You pick on me and people laugh. That's how it goes.
You're the foil. I don't pick on you.
Sometimes you do.
I don't pick on anybody.
Here we go. These biggish conferences are cesspools of infection. They can be, but look, I was at ASV this year. I was at...
It was outside.
It was mostly inside. It wasn't outside. Then there was ESCV in Manchester. And then so I've been all over the place.
But
There
you
was just
were required to wear a mask. ASV
ASV. I did have to wear a mask. Yeah, that's true.
and ECSV, you were required to wear a mask. ASM, you were required to wear a mask.
It's
Then,
interesting. Oh, that's right. I went to ASM too. What about ID week? Yeah, that I had to
yeah,
wear a
ID
mask at
week
least.
required a mask.
Although at ASV I danced for 3 hours without a mask, and I figured that would do it, but it didn't. I always know that there has to be someone infected, right? If there's no one infected, you're not going to get infected. So it just happened to be near someone at ASTMH, but it's fine.
Can't believe that rocket science right there. You have
Come
to
on,
be near
Dr.
someone.
Rosenfeld. What is a virus's
Okay.
main purpose goal? It doesn't have any purpose or goal. They just arose. They're replicators, right? They can replicate, and I think they arose early in Earth's history before cells. They could self-replicate, and then
Well,
when
they had
cells
to rise early before cells.
didn't have to arise. Why would they
Well,
have to
yeah,
arise?
because you build off of them. They've acquired properties that then became cellular properties.
Speaking of evolution of viruses, I got an email from Jean-Michel Claverie today.
Oh, and
Well, he's putting together a special issue of a journal on giant viruses, right? And he asked me to spread the word because he said, a showman such as yourself surely has wide reach. And I said, you say that, I'm going to do anything for you. Right? A showman such as yourself. I'm not really a
yeah,
showman, though. Do you think I'm a
well,
showman?
yeah, you are. You got lots of shows.
But there's no purpose. It's just that whenever you have a successful system, parasites arise that cheat and will utilize components of the system to reproduce without paying a lot themselves. And so it's a byproduct of life, and there's no purpose, right? There isn't a purpose. You can't look at viruses as having a purpose. Amy has a purpose. She wants to do experiments. We all have purposes. It's not
It's kind of
viruses
a made up artificial purpose. I
doing
mean,
experiments.
man doesn't really have a purpose. I've
Oh, well,
decided to do experiments, but like technically, man doesn't really have a purpose. Like a cat doesn't really have a purpose. It needs to go out and hunt to eat, but it doesn't really have a purpose.
yeah. Well, if you read what is this book, Sapiens? I think is that it.
I
He's
don't know. I
everything.
didn't read that.
Everything's made up. Everything's made up.
Well, that's what I'm saying.
Yeah. Why did you choose to work on enteroviruses? Because I told her to. Let's see if she gets a response to this.
In part, but the other part is so when I was a kid, I used to have to do these book reports in science class. And the first book report I ever did was on Salk.
Really? That's interesting.
Yeah.
Jonas
First book.
Salk.
Yeah. So he had books, and Sabin didn't really have books that were geared towards him.
Mm-hmm.
Maybe because he was kind of a curmudgeon and he was second. But Salk did. And so I always liked polio. But, the thing is I didn't really come to your lab when I was a graduate student to work on polio. I came to do other stuff.
Yeah, but eventually I told you to work on polio.
Yes, you did.
Okay, this is a remarkable moment in history, folks. Amy agreed. Okay.
Remarkable.
This is 39 minutes, 12 seconds into a Q&A. Amy said I was right. It's going to be a rare event. I can tell you that. Are you still both masking in crowded places? Are you, Amy?
I did this weekend.
Because your mother was
I
there?
was kind of required to. Yeah,
Yeah.
we went someplace, and so Saturday morning we went someplace, and you had to wear a mask, or
Hmm.
it was suggested. You didn't have to, because I have to say, many people were not wearing a mask. But like when we were on the metro or the subway, whatever it is, when the car was not empty, uh, she said, "We don't really know these people. We should probably wear a mask." So whatever, it was fine.
So
But
I
most of
started
the places I go, I don't wear a mask. I don't
I,
go
s-
any place that's crowded.
I started to wear masks on trains because my daughter shamed me. She
Well, that's
said,
never good.
"Well, my daughter is not shy about shaming anyone," but she said,
Really? Considering the fact that she's like the first person to be like, I'm against bullying. Now she's a big bully. That's not a good policy.
anyway, she said, you don't have any respect for working people who have to work. You're going to risk infecting them. It's not
They're going to
right.
get infected and they should get vaccinated.
And she said, they don't have health care, blah, blah, blah. So I said, yeah,
That's
all
not
right. Okay.
true. But the
But Amy,
thing
I don't want to argue
is
about it. I'm
that's
just
not
saying
true.
I wear
Fine,
masks
wear a mask on a
on the
train,
train so
but
I don't infect people.
at least argue something that's true and correct.
Don't pick on my daughter. She's not here, okay?
Well,
All
she's
right.
ignorant, and I'm surprised at it.
If you had one choice, 2 COVID-19 vaccines or 3-shot dose for best protection immunity. Oh, the 3-shot dose. It's the best. The two initial and the boost. That's great. I think that's all you need. What were my first symptoms? Let's see. I think it was
Nose dripping. You had post nasal drip.
nasal drip, and then clearing the throat, and then it became coughing on Saturday. Yeah,
Well, your nose was red, but that was about it.
my nose was red on Twiv. What, you make note of these things? Ay, ay, ay.
What? At least I care.
Saying my nose is red doesn't mean you care.
Of course I care, you yuts.
No, I didn't say you didn't, but it has nothing to do with your nose being red.
Yes,
Like a
I
little-
care. I monitor how you look. I care.
Okay,
Otherwise,
thank Thank you.
For
Thank you so
fuck's
much.
sake.
Thank you.
Don't be patronizing.
I'm
Move on.
not
to the
patronizing.
next
When have
one.
I
Yeah,
ever
you
been
is.
patronizing? No. Can you become infected with Mycobacterium tuberculosis and never develop active tuberculosis? What say ye?
I'm not a TB girl. That was very contagious.
My dad had TB. Yeah, you can develop latent TB and not have disease. My dad had latent TB most of his life and didn't have disease until he got cancer, and then it went crazy in him. So yes, the answer is yes, you can be latently infected.
So he had no symptoms of the primary infection?
It's hard to know because he had it when he was in Italy and he was young, right? I don't think he did. I think he was just infected in Italy working in hospitals and was latently infected all his life. And then when he could develop cancer, he was full of TB, like it clogged his kidneys and all that. So it was really bad. If you get sick and much later take a booster, would the booster increase mucosal immunity as IPV does after OPV? Interesting, Amy. Someone's up on the literature, right?
Yeah.
I don't know if it would necessarily do that, right?
I'm sure it does.
I mean, I see. Yeah. So you think this booster would increase mucosal immunity? I think it might. You'd have to look at it, and it probably has been looked at. I just don't remember the results right now, but it could very well be.
Yeah, I think there's papers that say that that's true.
All right, Dunning-Kruger says, I've been trying to study Field's virology. I'm not sure how. Should I memorize specifics of each group of viruses?
No.
You should read Principles of Virology and learn by principle, not by virus. You're not going to learn virology by virus. My course is all about principles, and that's how you should first learn virology. And Amy agrees fully, because when she has technicians come, she has them read parts of the textbook. Right, Amy?
Yeah, give them the PDF. Oh, which reminds me, I have to send it to her. And that's what they read. Yeah.
With 10 days of Paxlovid, be in danger for resistance. Well, you can't take 10 days of Paxlovid. You can only take 5. But I'm not sure that it would be an issue for resistance, no.
Well, not according to the guy at Emory.
Right. Richard Plempner?
Yeah.
Can Paxlovid be crushed? Nope. Can't crush them.
Why not?
Gosh, we went through this weeks ago. I think they have an enteric coating. Yeah, they have an enteric coating, so you can't crush them. So they get released in a certain place. Sorry about your aunt. Carol is grateful for our clinical updates. Thank you very much, Carol. The XBB subvariant is said to be the most immunoevasive yet and resistant to monoclonal treatments. Would the bivalent vaccine be more effective? Not necessarily. The ancestral vaccine is really good at inducing antibodies to variants that you haven't encountered, and we don't know that the bivalent is as good. So, not necessarily is the answer.
It's all hypersomatic mutation.
It is. I'm curious about the immune system health of homeless people after many years of poor living, lack of sanitation, hygiene, bad food. So, Amy, tonight on the train, I'm taking the train, and there's a young mother with a very young child, and she puts it on the ground, and the child can't walk, so it's crawling on the floor, and her hands are on the floor of New Jersey Transit train, the baby, right?
Mm-hmm.
And I said, I need to tell this mother not to let her baby crawl on the ground, but it's not my business, because she's going to get stuff on her hands from thousands of people walking on the floor, and who knows what's going to happen to the poor baby. So this reminds me of that. Baby's going to get a big immune boost, I guess. But homeless people have all kinds of other issues, right? They don't have good health care, so they get sick, and it doesn't matter that they have great immune boosts from their environment. But it's really not been studied, as far as I know. What effect do boosters have on T cells?
Apparently little, according to a paper I sent you and Daniel, either this week or last week. It's in Science Immunology.
Meaning the bivalent booster?
Yeah, basically we've tapped it out. They're like, no need to keep boosting.
I think that's a good idea, right?
Yeah.
Not to keep boosting. Didn't you send also an article saying why boost is not a good idea?
Yes.
Yeah. I'm very happy to go back to conferences. I like meeting people. It's really a lot of fun. What do you think of the Pfizer data showing 4x increase in antibodies versus the original booster in people aged 55 and up?
Don't have any idea what it means.
Yeah, I don't know what that means. If it's clinically relevant, as both Daniel and Jake Scott would say, right? We don't know what it means. You know, what is it? The Moderna was 1.5-fold increase. We didn't know what that means. And this is a little more, but we don't know. No. I got COVID 6 weeks ago, bad symptoms for 10 days, not hospitalized. My partner and I didn't stay away from each other. He had no symptoms. How would you understand this?
Genetics, SNPs.
Also, you may not have been shedding that much, right?
Yeah.
If you were vaccinated multiple times, you might not be shedding that much. But also, as
Well,
Amy
I
said,
don't even know if they were both at the same event where they would have both gotten infected.
well, they're living together, right? They
Right.
didn't stay away from each other. So why
Right,
didn't
but that
one
doesn't
infect
mean
the
that
other?
they both were not infected at the same outside event. One just didn't develop symptoms. It's genetics,
I know,
right?
but why did one not transmit in-house to the other? That's the
Well, who
question.
says that he didn't transmit? He just says he doesn't have any
Yeah.
symptoms.
Okay, so
That
you could.
doesn't mean anything about whether or not you had a
Mm-hmm.
positive test. So I don't know
Yes.
where you just got that he didn't transmit.
I agree. It could be infected. Amy is spot on there. But so there are many asymptomatically infected people. So your partner could have been transmitted.
He just didn't develop symptoms because he has different SNPs than you do. I don't think why. I don't understand.
Relative I know took the 2 shots of COVID in India, Covaxin and Covishield. Hasn't gotten sick. Should she get a booster?
Sure, go for
I
it.
think you need 3 shots, especially if those first 2 were too close. So I would do that. Yep.
I don't think you need 3 shots, but sure, doesn't hurt.
What's your take on the suggestion that T cells wear out with every infection? I don't believe it, actually. I mean, so what happens is you have a pool of memory cells, right? And if you're infected, they differentiate into active effector T cells, and eventually they go away. They have to, just like antibodies contract. But you still have a pool of memory cells to go back to. So I don't think that this is an issue at all.
I think maybe he's talking about the idea of T cell exhaustion.
Mm-hmm. I'm not sure. Does that happen in COVID, Amy?
I don't think so. But I think he's not asking about COVID in SARS-CoV-2 infections. I think he's asking in general. And I don't know why we automatically default, well, does that happen in SARS-CoV-2 infections? Who cares? There's lots of things that are more interesting than SARS-CoV-2 infections.
You have to humor me.
I have been humoring you.
Good God. If looks could kill, I have been humoring me. Okay. Does the vaccine and boosters protect against severe disease, even if an infected person doesn't receive Paxlovid or Evusheld?
Yes.
It depends on how old you were when you got vaccinated, I think.
No.
If
My
you're elderly,
94-year-old stepfather got infected. He got boosted. Didn't have he only had 3 shots and he didn't have any symptoms and didn't require hospitalization. And in fact, the physicians that they told him they went to said he was not eligible.
So I have had 2 shots and a booster. I would have liked to see what happened, but I took Paxlovid. So instead of getting another booster, just get Paxlovid. That's what Paul Offit says. And so here, Painter says, I have 3 shots. I should get my 4th. No, I don't know how old you are, but if you're less than 70, no, don't get a booster. Just get Paxlovid if you get infected. That's it. It works.
The next infection that you get, you can not do Paxlovid, then we'll see what happens.
So, Amy, now I have 3 vaccine doses and a natural infection. What do I have in terms of immunity?
Immunity gangbusters.
Oh, thank you so much. Thank you.
We don't need any more stuff.
Viruses can exist up to 10 days on microplastics. We ingest thousands of these, absolutely. Apples and fruits of all kinds. Is this going to be...
How do you know that what viruses... I mean, just to say viruses can live up to 10 days on microplastics is very nonspecific. So plant viruses, okay. So let's say a plant virus lives on a microplastic for 10 days and we ingest it. Who cares? You just poop it out. There's no receptor. So I don't understand.
Well, maybe a new way of bringing viruses into you that you ordinarily wouldn't have. Okay. That's what Miter is asking. That's all. I don't see why it could not be a new
Well, you're going to
infection.
poop it out, right? Like pepper mosaic virus, right? Isn't our poop full of pepper mosaic virus?
It's the most prevalent RNA virus in human feces.
Yeah,
Pepper mild mottle virus. Yeah.
right. But it does nothing.
Well, if it's a human virus, it could do something, right? So
Right,
that's the
but he
point.
just says viruses. If you don't expand, I could think of I can think of anything as a virus, and you just poop it out.
Okay. Have you seen this Paxlovid study, which reduces risk of long COVID by 26%? Actually, Jake Scott sent me an email about this. He said,
And
all right. So first, these are really good points. Listen to this. It's a retrospective cohort study that used electronic health records to look at various medical events and symptoms reported within 90 days of a positive SARS-CoV-2 test. This obviously doesn't say anything about long COVID, which is defined as the symptoms persisting at least 3 months, and the date of a first positive doesn't necessarily correlate with the onset of symptoms. Observational studies of Paxlovid are especially susceptible to confounding for two reasons. One, it's often withheld from people who are on certain medications. These people may be at higher risk for poor outcomes, which would skew results in favor of Paxlovid giving better outcomes in the group who aren't on certain medications. And two, high-risk individuals may develop worsening symptoms after 5 days of illness when they're no longer eligible for Paxlovid and may have worse disease trajectories, which would also bias results in favor of Paxlovid. So those are good points. Thank you, Scott. Jake, I mean. And I would agree with that, CK. How useful do you think computer-aided drug design is right now? You have any feel for that, Amy?
well, we've been doing it for several years, right? For several years now.
Mm-hmm.
When was the last time? What drug has been licensed that came from computer aided?
Tamiflu.
Okay.
And I believe Paxlovid, the early candidates were computer aided. I think it's a starting point, and then you have to make chemical modifications, obviously. So I don't have a
I'm
problem
not sure
with
that
it.
Tamiflu is really computer aided, but
Yeah, it is.
sure.
I'll show you sometime when I see you. I'll show you. Well, I'm never going to see you, but I'll.
Okay, fine.
I'm just
Okay,
kidding.
move on.
I'm going to show you. I'll send you the paper, okay?
I mean, I just think that there's a lot of, oh, we're going to make structure based vaccine stuff. And I'm not sure that that's going to work out so well. I'm sure you can make one or two, but I don't know that you're going to make 500.
How do I get the T-shirt? Here you go.
Vax.com.
Vaccinated.us.
No, .us, not .com.
It'll be, you can do it till the end of the year now. Thank you, Vaccinated and Matt, for supporting us. Really appreciate it.
Cool.
Here we go. MK, I'm late to the show. Enjoyed the Tweevo. Thanks for the link to the smallpox history. Yeah, it is a really good smallpox history, which is a free PDF at the WHO site, which was my pick of the week on Tweevo this week. You might want to check it out.
Cool.
And Dr. Scott saying Omicron is milder, population immunity. So we just talked about this, and immunity could be part of it. And patient population can be another. And Daniel, as we said, doesn't agree with that. So. California Association of Long-Term Care had 2 ventilation specialists on. Message: fresh air exchange, open windows if safe, and clean filters often. HEPA filters greater than 13. All right. Thank you. Can't wait to debunk the funk. Let's still tweet Gladwell. He even liked one of my tweets praising Twiv. Oh, that's a good idea, folks. So Silvio Pina and others tweet Malcolm Gladwell and say, hey, Vincent, Prof VRR on Twitter, is trying to get in touch with you to get you on Twiv. I DM'd him, but he didn't answer. So do it. I think that's a good idea. Thank you very much. Can I come visit if I don't get in? Of course you can. Come to the incubator. If you don't get into Columbia, you can come visit anytime. Absolutely. No problem. What is the best possible way to study cell-mediated immunity for a viral vaccine in an in vitro model? Take it away, Amy.
Cell-mediated immunity in an in vitro model?
Yeah, so you have a
Good luck
vaccine.
to you.
Well, you can take T cells out of the mice and put them in vitro and study them, right? Isn't that what that means?
I don't know. That's not what I took it to mean, but okay.
So you can take lymphocytes out of your immunized mice, you put them in culture, you add peptides to see if they're stimulated by virus-specific peptides, for example, which is something that Amy is going to do in her laboratory, right? That's
Yeah,
what
but
I
I
think.
wouldn't have considered that an in vitro model.
I think it is. I understand what your concerns are, but I think that's an in vitro model.
Okay. But I'm looking for their ability to be cytolytic, like CTLs, not just
My husband came
whether or
home
not they.
sick. Sorry. Yes, I understand what your concern is. Yeah.
Yeah. Okay. Your husband came home sick and what?
Some nasal draining negative, home test negative. Well, it may be something else. I mean, a month or two ago, I had respiratory symptoms, and I tested, and I was negative. It was something else. So, if you're concerned, yeah, you could test tomorrow, but if it's negative, that's it. Something else. There are other viruses out there.
Really?
Did you know?
No. I thought the only two viruses in the world were polio and SARS-CoV-2.
What about enterovirus D68?
Apparently, it it's apparently it's not that important because there's no AFM this year. It's gangbusters. I mean, the amount of diagnoses of confirmed EV68 infection is super high, but no AFM.
Did you know you're trying to draw me out of my shell?
Yes.
I'm not in the shell. I've been out of my shell since I started this education thing 15 years ago.
Yes.
What
Yes.
Amy tries to do is get me to be successful, right? She
Yes.
pushes me to do things. And then when I
Yes.
push back, she says, I'm just trying to make you successful.
Yes.
Okay?
Yes.
I don't think I'm in a shell. I'm not shy.
Yes.
I mean, I go up to people I would never have gone up to 30 years ago. There's also age, too. As you get older, you get more confident.
Yes.
Smallpox is back. No. Smallpox is not back. When would we have said this and this that would have confused her in this stream, Amy?
I don't know.
No.
Maybe when we were I don't know. When we were talking about black plague, I don't know.
So I mean, I was talking about 30% mortality of smallpox when it circulated, but no, smallpox is eradicated. It's not back at all. Is it worth getting the bivalent booster to prevent transmission to vulnerable relatives? 2 months out from COVID will be 3 months when Christmas. What do you think, Amy?
I'm not a big fan.
And we just don't know if it does anything, but it doesn't hurt,
I
right?
was going to say, I'm not a big fan, but hey, if it makes people feel better, go for it.
But the Paul Offit said, the fact that it doesn't hurt is not a good public health strategy. Usually,
I know. That's what I just said.
You want to make decisions because you have good evidence, right? This is the bubbliest I've ever seen Amy. Good.
Yeah.
Amy's must be less stressed these days.
No, I'm overstressed.
Oh, I see. Why doesn't the eradication of rinderpest convince anyone that multi-species viruses can be eradicated?
I
What
didn't
do you
know
think?
rinderpest was a multi-species virus.
Yeah, it can infect cattle. It can infect humans. Primarily cattle and buffalo. So, it really wasn't a multi-species virus. I mean, it would spill over periodically into humans, but didn't become a human virus, transmitted human to human.
Yeah, that's what I'm saying.
So that's why I don't think that's right. Yeah. Amy is often glittery though when Jen sends her glitter art.
Yeah.
Yeah.
This year we're going to hang. So last year she sent me glitter viral snowflakes, and I didn't hang them because we were always going to move. This year I'm going to hang them in my lab, and then they're going to glitter and fluoresce at night because they'll be charged all day long. I'm going to have glitter windows. I'm very excited for glitter windows.
Yeah, that should be fun.
Yeah. I'm the only person in the whole FDA who's going to have glitter windows.
You're the only person at the FDA that has a lot of things.
That is true.
You're the only investigator there on Saturdays and Sundays doing plaque assays, for God's sakes.
That is true. I'm also, yes, that is true. I'm probably the only person who didn't know Friday was a holiday. I was like, what? Friday is a holiday? I was like, what holiday is Friday?
So, any comments on respiratory syncytial virus?
Lots of cases because we have low immunity.
Because we masked and distanced for a couple of years, yeah, and mostly young kids, right? But also some elderly.
Some elderly, it bothers the elderly.
So we have SARS-CoV-2, we have SARS-CoV-2, we have influenza, and we have RSV circulating at the moment, right?
And rhino. And 68.
Okay. Sandy is the Dr. Wilson's moderator. Very nice. Other handle is Environmental Coffee House, which I also see here and which I've seen for a long time. I'm going to be on, he's going to be on TWIB, as I just mentioned. I think December 8th. Is that correct?
Cool. Yeah, something like that. That's what you told me.
Yeah, so that'll be fun. He's excited to do that. I didn't know he was outside of Philly.
Oh, we're outside Philly, in Jersey or Pennsylvania?
Pennsylvania, but I'm not sure.
Oh.
Now, Sandy, I've lost where I am in the comments. Here we go. Oh, there we go. Glittery, Sandy. Okie dokie. How many viruses can fit on the head of a pin? Well, if they're rhinoviruses, 500 million. What do you think of that, Amy?
It's a lot of virus.
Are you hungry?
Yeah, I haven't eaten dinner yet.
Do you want to go eat?
We're doing the live stream.
Listen to this. New studies indicating more boosters, possibly more infections, not disease, and bivalent booster, little improvement of T cells. Did Amy say you think? I think that's great.
Yeah. Yeah.
Yes, Dixon is doing fine. He's just doing great, and he has no issues whatsoever. Let's see here.
Visit Dixon on Friday on TWIF, released on Sunday.
I'm excited by Dr. Wilson's going to be on the channel. He loves you guys. That's nice. We love having people who love us.
Maybe you should be on Debunk the Funk. You could do debunk, I don't know. I don't know what he does.
He debunks the funk. He debunks things.
Well, you could go on with him and help him.
What would I debunk?
Seriously, you have to ask.
I could debunk a lot of things. You're right.
Okay, fine. Here's one of them. You could debunk the idea of eradicating polio.
Okay. Hey, I talked about that in my class today. Not my
And
class, but Steve Morse's class where I was a guest lecturer.
and
I said, with so many asymptomatic infections, how can you eradicate without checking the wastewater and just looking
how
for
can you
paralytic
eradicate it
cases?
all? How
I don't
can you
think you can.
eradicate it all?
I've changed my tune. I don't think you can.
Well, lots of people are behind the time.
So Grazia's definition of mild is I don't have to be in bed for days. My colleague, vaccinated and boosted, got infected, had severely distorted taste for 8 weeks. Well, my taste isn't distorted. I just have a funny taste because of the Paxlovid, because of the ritonavir part, right?
Yeah. But you gotta feel bad for all those people who take ritonavir on a daily basis for the rest of their
Yeah, I
lives.
can't imagine that. Absolutely. She didn't end up in the ICU, so that's a win. Absolutely. Love you guys. My favorite source of info. I'm probably one of the few guys that's interested in what brands Amy is wearing.
Brands of what?
Clothing. What do you think?
I know, but what kind of clothing? Are we talking jeans? Are we talking sweaters? Are we talking shoes? What kind of clothing?
Let's start with jeans.
7 of all mankind.
You know, you made me buy a pair of those like 20 years ago, and they cost $200, and I hardly wore them because they're too tight.
So wait a minute, you're blaming me that they were too tight? You could get any size you wanted. Why would you get the too tight size?
I don't know.
I don't understand. And jeans are not $25.95 anymore, Vincent.
They were $200 at the time. It was ridiculous
No,
to
they
spend that
weren't.
kind of money. I would not spend more than $30 on a pair of jeans. You can get Sonoma jeans for $30, and they fit me well.
That's all that matters. It doesn't matter what how
7
much
of all
they
mankind.
cost.
What kind of
Yeah,
shoes?
they fit me well.
Well, let's say, what kind of sweaters do you like? That's the last thing. Then we'll move on.
So I have sweaters that are from DKNY. I have some Michael Kors. I have some Saks House brand. I have Lafayette 148. I have some Theory sweaters, some Burberry sweaters. I have some Max Mara sweaters.
It's good stuff. I have all garbage. All right, let's move on.
I don't understand.
You can't say SARS-1 was more virulent than SARS-2. No, you can't. How are you going to compare them? Totally different populations, different amounts of just different viruses. You cannot compare the virulence of different viruses. You can't compare polio with smallpox. You can only compare polio viruses, and you have to use the same exact assay, which doesn't happen in people. So there's no way. Patricia, it's a big emphasis in my course. You cannot compare virulence of different viruses. You can only do similar viruses, and you have to use exactly the same infection protocol. So that completely rules out comparing virulence of viruses in people by hospital observational studies.
Yes, but yet we quote people all the time about that.
Yeah, we do.
Not so good.
Dr. Scott left us with the impression that Omicron is less. Yeah, he did. It's his clinical experience. That's what he said. Because I said to him, but Daniel says no. And he said, this is my clinical experience. And that's all you can do. There's a clinical view of virulence and there's a viral view, as I said before. Are the chest x-rays showing ground glass? I didn't get a chest x-ray. I didn't need to. I don't know what you mean, but you can have ground glass without any symptoms. There was the very first asymptomatic infection in China was the son of 2 people who had been infected and had symptoms, and they decided to x-ray him. He had no symptoms. He had ground glass opacities in his lung. Quite interesting. Does the data support vaccine boosters for children under 12? After listening to Paul Offit, I'm uncertain. I don't think a kid under 12 needs a booster. Do you, Amy?
No.
Unless they're maybe immunocompromised?
Might be.
Amy?
Maybe.
Go easy on Vincent. He's getting over the COVIDs.
There's more than one COVIDs?
I
There's
just
more
like
than one COVID?
I
There's
like the way it
COVIDs?
sounds. The COVIDs.
The
Daniel says,
COVIDs.
"You got the COVID."
You got the COVID? I don't understand this. Is that even grammatically correct? The
No, it's not.
COVID?
It's just a colloquial way of saying it.
Oh, okay. Just making sure I wasn't losing it.
What are your thoughts about MCH1 breaking up spike to allow for T cells better attack the virus, resulting in what is MCH1, Amy?
I don't know.
Is it a protease?
I don't know.
Sorry, I don't know anything about it.
I think he's like spelling MHC1
Oh, MHC1.
backwards.
No, MHC doesn't break up the protein. There's a protease inside the cell that breaks up the spike, and then it's presented on MHC, and then the T cells can recognize. Now, whether that results in asymptomatic infection or not, it's possible that the T cells can clear infections rapidly, depending on the person, but we don't know. So this is another thing that that Jake Scott said, that Omicron replication is mainly restricted to the upper tract. Yeah, but I don't agree with the data that showed that, because they don't use proper methods, I think, and I think they use a lot of explants that don't really work. We did this study a long time ago on TWIV. I don't buy it.
On the TWIV? Is that on the TWIV?
It's kind of
on
like the
TWIV?
COVIDs. The COVID's on the TWIV.
Yeah. Is it? Is that like on Golden Pond?
Yes, to Q&A on the road. Universities, not so much, I think. I think most of you are not affiliated with universities.
No, I don't want to go to universities.
Yes, a lot of Steph says love live stream on the road. Yeah, okay, we'll work on it. We'll work on it. But we're gonna do big cities in the U.S. first, see if it works. Take it on the road, but I'm in Columbus. I don't think we're going to go to Columbus, although we're going to be in Columbus in a couple of years for ASV, Lise. And if you want to come to the TWIV, I'll get you in.
Oh, like there's a ticket.
There's the Vinny.
There's there's a ticket.
There's the Vinny ticket.
The Vinny ticket.
I'll get her. I'll get Liz in for sure.
Okay.
Everybody wants to come in. I did that in Madison. I got people in. It's not a big deal. Take it on the road. Portland, Boulder, DC. Should we do it in DC? Do you know any small club we could book, Amy, in DC?
Sure. Yeah, we could do it in DC. Sure.
Charlotte likes it better when we get along and we're not fighting. You see, sometimes we fight, Amy.
We don't fight, Vincent. We have discussions.
Well,
we don't
Charlotte
fight. We have discussions. Well, it's not fighting. We have discussions where you need a little impetus to get back on the right track.
So Sea King Pros in Canada, but we're going to actually be in Canada next year. Where did I tell you?
Montreal.
Quebec City. Oh.
No, you're going to Quebec City. I thought you were talking about ASV. Yeah, you're going to Quebec City.
No, ASV next year is in Georgia, but the following year I think it's in Montreal. And yes, we need to promote it beyond the 400 to 500 present here, obviously. But you're like a test audience. We'd like to ask you if you'd go, because if you don't go, nobody else is going to go, right? But we'll have to promote it. I have to get a proper promoter and pay them to do it, right?
Yeah, I guess you need Don King.
You know, Amy can only come and do it and go back because she can't take time off from the FDA because she's fancy pants at the FDA, right?
Well, today, you know what I did today?
What'd you do?
5 Zoom calls today.
Oh, now you're an administrator, huh?
Well, first I talked to the chair at George Washington. Then I did a grant review. Yeah. Then I had a meeting. Then I did another grant review. And then I had another meeting.
That's pretty cool.
It's too much Zoom.
Someone wants to know, Okay, Ohio State, June 24th to 28th, 2024. That's ASV, Ohio State University at the Convention Center, June 24th to 28th. That's for Liz, who wants to go. So put it on your calendar, and when the time comes, you send me an email, vincent@microbe.tv. You say you want to go, and I will stand by the door and make sure you get in. Okay? And if they don't let you in, I'll say, I'm not doing the show unless you let Liz in. Okay? Because Liz is a fan. How about that for loyalty?
Good.
Raphael, natural immunity plus vaccines still better than just vaccines, or there are no more studies. Dr. Karate said we may be okay for years, at least for severe cases. What do you think, Amy?
What's the question?
Is natural immunity plus vaccines still better than just vaccines alone?
For sure.
Okay. Would a roadshow be in a ring? No, we would sit on two cozy chairs next to each other. Right, Amy?
Yeah, what's the ring for?
Fighting. A fighting ring. It's a joke.
Yeah, no ring.
What's the mechanism of action of Paxlovid, Amy?
It inhibits the protease.
Yeah, there's a protease encoded in the viral genome that's needed to chop up the viral protein because it's made as a long precursor, and this inhibits it, so it blocks reproduction. It's very simple. This is cool. Frank would drive from Santa Barbara to L.A. to watch us. Thank you, Frank.
That's very lovely.
Patricia would go to D.C. or Richmond. We could do D.C.
For sure.
Bring Q&A to Australia. That's probably too long for Amy to go away.
Well, for this moment, yes. Maybe
Amy,
in a few years.
Could we do Miami? Is that a good venue, or
Yeah, that could be fun.
what's the deal with RSV? As Amy said,
It's gangbusters. We got gangbuster RSV.
because we were
It's all
sheltered
over
and we
the
didn't get
place.
immunity. Yeah.
All over the place. Everybody has RSV. Flu guy from down the hall from me.
Mm-hmm.
Kid came home, gave it to everybody.
So the Green Times Art Studios is in Taos, listening in Taos. Very good. I love
Cool.
Taos. Used to go there all the time. Haven't been there in years.
I never went.
Did Amy find a lab person yet?
I did.
You hired her?
Yeah, I have, and I have to send I have to deal with all the paperwork. I don't know because the government paperwork is not something I'm familiar with. So hopefully she'll be here by January 15th.
Good.
But it might take longer. But yeah, I hire her. Yeah, it's good. She's excited. Actually, her boss is even more excited because I think her boss is the one that I was talking to when we solved the structure. So I think she was more excited.
So she found this through TWIV, right?
Yeah, she's a TWIF listener.
Good. Recent paper described the use of a COVID-19 vaccine using an attenuated virus made by substituting, so codon substitution, I would guess, right?
The optimization.
What are the chances of this vaccine mutating?
Depends on how many codons they de-optimized.
Yeah, I think they have a lot of many thousands of changes, and so it's unlikely to revert. Yeah. Why did you take Paxlovid if you had mild symptoms? That's a good question. I texted Daniel. I said, I just tested positive. What do you think I should do? He said, oh, you should take Paxlovid. And so I did. You know, I always say to have a plan, so I did. And within 24 hours, all the respiratory symptoms were resolved. So I guess it worked. Although you don't know, right? Because I didn't do a control on myself. I was very curious to know without treatment what would have happened. But Daniel said that you should do this. And I do trust Daniel. I trust his clinical judgment. And I think that's important for you to trust the clinical judgment of your doctors too. You say you can't tell how virulent a virus is. What about HIV? It attacks T cells. Well, you can say a virus is virulent. If a virus causes disease, it's virulent. The problem comes when you try and compare it to another virus because the diseases are so different. How can you make a comparison? It's like apples and oranges, right?
Mm-hmm.
Dixon's good. Yes, I did get COVID. I'm good. Dawn, who's in the Netherlands, I remember. I just got out of bed because I can't sleep. It says the A&V virus, right? You should write a book, Amy, at one point about your life and call it the A&V virus.
The A&V virus?
It has a good ring. It has a good ring
It does
to
have a good ring, but why is my life so interesting?
Just write the book and then you'll find out.
Okay, I'll write the book.
Is COVID bad? I don't know. I had a very mild infection for a day and I took Paxlovid and that was it. So if you're freaking out about getting it, just make sure you get Paxlovid. Patricia, you'll be fine.
Well, make sure you get a plan. She might not be able to get Paxlovid in her neighborhood. She needs to have a plan.
I mean,
not every place can get you Paxlovid.
I understand.
Maybe there's some plan. Maybe she's out of the United States and she's living in Guam.
Well, in Canada now, people are saying it's hard to get.
Okay, so just have a plan. Make sure you have a plan.
What do you need, Amy?
A plan.
I texted Daniel at 5 p.m. Saturday. He asked for the phone number of my pharmacy and my date of birth. He sent it in, and they didn't want me to go pick it up. So I couldn't go pick it up, but my wife went and got it.
So then what did it? Oh, it walked to your house?
Didn't walk to my house. No, so that's it. What about people who have never had COVID and aren't vaccinated? Is there any update on natural resistance? No. But as Amy said, there are likely genetic influences that are controlling that, for sure. Clinically mild, so few are immune naive after vaccinations, virus intrinsically not milder. Can you really compare it to earlier period? No, you can't. That's why Amy and I were a little testy about it earlier. We can't compare. We concluded we can't compare.
We concluded.
No, I didn't have magical immunity. It's just a matter of time. And as Amy said, she will get infected at some time, but you may not know about it because she won't test herself. Probably. But she's very young. She doesn't need to do that.
Well, the thing is I don't believe in testing unless I have severe disease and I'm going to the hospital. I don't know why everybody's testing. I mean, if you're so sick and so concerned, go to the hospital and get tested, and they'll do a whole respiratory panel on you, and you can decide what you have. And no, I'm not grumpy.
Amy's not grumpy. She's just here. She's deadpan, right? She can be deadpan. She has sarcasm for sure. Yeah.
Just a smidgen.
Or maybe deadpan sarcasm.
Just a smidgen.
Just a smidgen.
Yeah,
Lori also has sleep issues, can be a real drag wandering around the house.
It is a real drag, let me tell you. You get into bed, you go to sleep for 15 minutes, and then you're up for like the next 4 hours. It's a real drag. And then by the time you fall asleep again, your neighbor across the street turns on their spotlights. Total drag. It's okay. I'm sure that they don't know that their spotlights flush into my windows. Plus, they would just say to me, tough luck, pull out your blinds. I'd be like, no, don't like blinds.
Is there a definitive paper on the number of people in hospitals who are vaxxed versus unvaxxed?
How could there be a definitive paper? It changes all the time.
Well, Daniel always says that most of his patients are still unvaccinated, 90%. But I don't know if it's been published.
I don't know.
You guys follow COP27. Evidently, there are viruses in the permafrost that could potentially infect people. I don't know that they
Yes.
can potentially infect people, but there are viruses in the permafrost for sure.
Yeah, I think Eddie Holmes has a new paper about it, or somebody related to Eddie.
Yeah, I saw that recently. Was that Eddie who did that?
I think so.
COP27 is a global warming summit type thingy. It's not a virus, but
No,
with
I
global
know, but
warming,
I could have
viruses are going to
sworn
be
that I
released.
just, I could
Yeah,
have
there was a
sworn I
new.
just saw there's a new permafrost paper. Maybe it wasn't him, but it was somebody
Yeah,
who's like he associates with or something.
I'm just not sure that we know that there are viruses in there that are going. I mean, you could worry about it, but there's no evidence that there are viruses that are dangerous.
No, but there are definitely viruses.
Yeah, I agree for sure. Raphael says my first video was also Vincent's false positive. The same day my test was a real positive. CT18, yeah. That's good that you recovered. But mine was my CT was like 42 or something. What are you doing with the
Yeah,
microphone, Amy?
it's all tangled. I was detangling.
Poker face. I think you could have a poker face too, right?
I guess so. I don't know. I never played poker.
It's one of my favorite Lady Gaga songs. Do you like Poker Face?
Yes, I do.
I'm 11 days post-positive and 13 into symptoms, still showing up positive lateral flows. Am I likely to be infectious? No. I don't think you're
No.
infectious. I think it's just broken virus, yeah. Protease inhibition is not usually long-standing. Well, it's once the drug goes, once the drug goes away, there's no more inhibition. But you dose for 5 days, and that's enough to get rid of your virus. And that's it. Amy, are you from Baltimore?
No. No.
Sardonic. Sardonic is another one. That's a good word. Amy
I
can
don't know that I'm sardonic.
Why not? Do you know what it means?
Why don't you tell me, since you think I don't know what it means?
Grimly mocking or cynical. Mocking or cynical. I don't think you're mocking, actually, but sometimes you could be cynical.
Your cynicism is my realism.
Your cynicism
Is my realism.
That's very profound, Dr. Rosenfeld. I like that. So in other words, I say that experiment's not going to work. And you say, yeah, it will, and it works, right? Very good. This is the shining moment of this Q&A. Your cynicism is my realism.
Yes.
Sticky note
You need
takers,
a TikTok.
Take
No,
note.
you just need a TikTok of it.
Just wondering if there are any other advantages of getting a combination shot of flu, RSV, Omicron besides reducing the number of shots.
No.
I think Masa is working at Pfizer in New York, if I remember.
Yes,
right?
she is. Yeah, she's from Beloff's lab. Mas, I'm going to see George on Saturday. I'm going to the retreat with my poster.
Amy has a poster. It's very cute.
I'm very excited. It's the first poster from my lab. I'm very excited.
Masa, come visit the incubator. I know you're busy, but it's a fun place. Just 10 minutes. You'll like it. It's not too far from you. Anyway, but
Yes,
back to
it
the
is.
question.
She's in Pearl River. It's like
thought you
an
was in
hour
New
and
York
a half.
City. Oh, okay. Forget it. I thought you were in the Manhattan.
Pearl River.
I thought you were in the
No, that's all
Manhattan.
offices. The labs are in Pearl River.
All right, forget
That's where
it.
Bob is.
You can't come.
Bob's
Sorry.
Don't tell her she can't come, but it's not 10. It don't pop in for 10 minutes. Come for your fundraisers. Be a supporter. Have some.
So is there an
food and
advantage?
snack.
There's no advantage other than convenience. Okay. There's no adjuvanting or anything like that, as far as I know. Okay. No, it's just convenience. Thank
Definitely
you, Doreen.
not.
Thank you, Doreen, for your contribution. Appreciate it. It's not a protease of the host. It's a viral protease that's inhibited by Paxlovid. Yeah. Thanks, Doreen, for your contribution. Do you concede that you can know what a nasty train wheel tastes like? I have a funny taste. Cinnamon gum and hot tamale candy. So I was trying to remember what you said, and I couldn't remember. So I just have some cough drops, right? I carry around with me. These are crappy Walgreen cough drops. They're
What
so
flavor
bad.
are they? What flavor are they?
Oh, it's menthol.
Well, that's why it's bad. They're supposed to be curry.
I have some Ricola, the Swiss cough drops. I ran out of them. I used my last one in lecture
Lemon?
today. Yeah, I like
Were they
lemon.
lemon?
They're good. They're good. You know the Ricola or Ricola? I don't know how to say it.
Yeah, I know the brand. I never eaten, but I know the brand. But you can buy them at the Dwayne Reed on the way to the incubator when you get out of Penn Station.
Oh, the Dwayne Reed right underneath there? Yeah, okay. It's a little weird place, but I'll go in there, yeah. I don't know that
They're
it's a
all
train wreck.
weird.
But Doreen, I found that the taste was worse if I wake up at 3, 4 in the morning, which I always do. I always have these full body sweats in the middle of the night since I had Paxlovid, and that's when the
I think
mouth.
it's side effect of the. I think it's side effect of the
The
drug.
drug, and that's why. That's when I would taste it the most. I assume because I had nothing in my mouth for several hours. But yeah, but you can deal with it if you put things in your mouth. You're right. Cinnamon gum and hot tamale candies. I don't know.
I don't see you doing either one.
I don't chew gum.
Sometimes you do, but I just don't see you doing that.
Let's see. How to reproduce when visiting a cell, how to spread from one individual to another, how to evade host defense. I don't understand what this is about. Maybe he's Virotyro's answering Touche 410, so I'm not going to deal with that.
No, we don't need to interject.
I had an upper respiratory infection for a month. I had no clue a virus can last that long. Well, yes. It
Doesn't have to be a virus. Could have
Doesn't have to
been
be
virus and then bacteria.
could be two, or you just could have the long-term inflammatory phase. A lot of things can happen. Okay, so I saw this in the beginning when I mentioned this, and I saw that, and I want to answer this. How did the first viruses replicate if they predated cells? I'm not being sarcastic. I know there's very little sarcasm in this show, except for Amy, of course.
I was going to say, what are you talking about? I'm all sarcasm. It's called self-replicating RNAs.
Yeah, they're self-replicating RNA. So in other words, they could reproduce themselves in the absence of cells. And this has been duplicated in the laboratory now, so we know in theory it's possible. Yeah.
Just have to wonder where the nucleotide pool is.
That is a good point. But it has to exist, right?
Apparently so. But isn't that the famous Stanley somebody experiment where he took all the elements and he shot them with UV light or X-rays before the atmosphere, and he made some kind of protein gush and nucleic acid gush, in the 20s? You know what I'm talking about?
Yeah, you're talking about, but that's not considered to be correct anymore. I just want to show you this stink bug that just landed on my paper. Look, you see it?
Lovely. What are we going to do with it? I see it. What are we going to do with it?
I'm just going to put it over here.
Okay, put it over there.
Have
it go to some other place in the house. That's
I don't
want
to squish it. I don't want to squish it. It'll smell, right? And I don't like to kill bugs. So Peter says, nature calm, mild infection. Yeah, these people are, I'm not sure where this was done, if this was done in an animal model or not, but you can find animal models where it's not mild, and you can find people that are killed by it. So I don't think it's mild. What is harvest effect controversy? Do you know what that is, Amy?
No. Some people call it immunity debt, which is apparently anti-science. The counterclaim says COVID-19 suppresses immunity. Generally, does it explain the rise in RSV? No. Because RSV is not necessarily in people who have been infected with SARS-CoV-2.
No, that's correct.
So therefore, it cannot explain it.
Dunning-Kruger says, I heard once that once polio is declared eradicated, all stocks will be destroyed. What's the point? Can't people just reconstruct it?
Yes, that's one of Christia's arguments.
Yeah, I mean, some people say that you just should get rid of virus so you don't have any accidents. But, yeah, you could make it. But that would take some effort to make it, right? So it's not straightforward.
No, what are you talking about? It takes no effort whatsoever.
For Peak to do it would take effort. Peak couldn't do it. So there you go. Where Peak could go into a freezer and pull out a vial of polio, right?
Really? Where's he going to get the freezer that's full of vials of polio? At the Kroger next door?
Kroger? Is that what you said? The Kroger?
Yeah, the Kroger.
What is that, a supermarket or something?
It's a supermarket in the South. So every time somebody said something that was kind of silly, I would say, so you just went to the Kroger, right? Because the Kroger, like, it was the first supermarket I ever saw that was so huge. It had beer, it had wine, it had cheese, it had everything. It even had furniture for your patio.
There's stores like that. Now they're big
Well,
box
apparently
stores.
so.
But look, the point is...
But it was like, oh my God. You get everything here at the Kroger.
The point is that to synthesize the whole genome is hard. And if you sent the genome sequence in to a company, they would flag it and not give it to you. Whereas if you had lots of vials of virus around, you could imagine accidents. Okay, so that's the argument for destroying this. I destroyed all of mine. They're all gone.
No, they're not. They're in my house.
Liam says, my first micro assignment was on polio. It's been my favorite virus ever since. Thank you. That's great. I worked on it for 40 years. And now Amy's going to work on it for longer, right?
Yeah.
Well, maybe not polio, but enteroviruses.
I'm working on it. I work on it a lot. I work on it in various different ways. So, oh, yeah. Don't forget at the Piggly Wiggly. But no, the Piggly Wiggly, not so good. Kroger, much nicer than Piggly Wiggly. Piggly Wiggly was a dump.
So, unfortunately, it looks like Environmental's cat died. We're sorry to hear that.
I'm
sorry, Environmental. It's always sad when you lose a pet. Your daughter's actually right about quite a few people don't have insurance, unfortunately. Yep. I'm curious about RSV symptoms in adult humans. I had a viral thing that lasted a month. Do you know anything about older people's symptoms, Amy?
Yeah, there's severe respiratory disease, cough, congestion. And now it's not just in older people. Like the flu guy down the hall, he's in his early 40s. He had RSV from his kid. Severe nasal drip, lots of green gooky mucus, cough, low fever, not so comfortable.
Good news is you've been boosted and without serious illness. Yeah, well, that's good thing with Paxlovid, right?
Well, who knows? Yeah. Who knows if you would have had serious illness without Paxlovid?
We'll never know. Nope. Amy, are you single? Let me know. Not rich, but I have a big heart. I'm getting a date request here on Q&A.
That's good. Yes, I'm single.
Isn't that cute?
It is very cute. You don't have to be rich. You just have to be a nice guy. It's good.
That's so cute.
It's very cute.
Very cute. I'm scrolling down here. Oh, don't worry about it. It was a long time ago. Thank you for being concerned, though. But time heals everything, pretty much, I find. Can we talk about parasites? We are. Viruses are parasites. I know you want to talk about eukaryotic parasites, but that's the subject for TWIP. Hey, do you think Dixon would like to do a Q&A one night on parasites? I bet he would love it, right, Amy?
Yeah, for sure.
We should bring Dixon into this. Well, he'll tell me, oh, it's too late. I can't do it from 8 to 10. I have to go to bed.
It doesn't need to be 2 hours. You could do Dixon for 8 to 9 on Tuesday evenings.
No, I don't want to do it every week. I just want to do one episode with you.
And once, yeah, we can, yeah.
Could you use a viral genome for a dating method in archaeology? So, in other words, if you found viral genomes in archaeological specimens, could they help date it?
Yeah, for sure.
If you had a good database of that particular virus, you need to have, samples over the years to calibrate it. If you just had the one, then you couldn't use it. But so if you had a bunch, depending on the virus, then yes, you could do it. Yep. Thank you, Holly, for your contribution, making the world a better place. That's very kind of you. I really appreciate it. And yes, here we are, a virology family here on the Wednesday night Q&A. Have you heard about is Matt from Hawaii, by the way? I know there's a Matt in Hawaii. Have you heard about poor fatty acid metabolism, mitochondrial health being linked to long COVID? Have you heard that, Amy?
No.
I've heard other things linked to long COVID, but not that one. Some funny comments here. How many people have become healthier by eating better and exercise as a result of the COVID world? I don't know.
You one of them.
Why am I one of them? I had
You
nothing to do
started
with
to
COVID.
exercise.
Yeah, but it had nothing to do with COVID.
Doesn't matter. It was in the COVID world.
All these articles Amy gets info from and sends to you would be interesting to read. Can you get links for them? So, Stacy, you want me to post like all the Amy articles? I could do that. Get somebody to do it. If you want me, I'll do it. I'll put up a page on Microbe TV. Yeah?
Sure.
Sure, I can do that. Sylvia, thank you for your contribution. Trying to piece together all the polio info. I'm pretty sure I got sugar cube in Italy in the 60s. If I can verify that, am I relatively protected, or what do you recommend?
You definitely got sugar cube in Italy in the 60s. You're fine. You don't need any booster. You're fine.
Did Amy encourage her mother to get the new booster?
What new booster?
Yeah, the bivalent booster.
She called up and she said, I got the booster.
She didn't ask you, in other words, right?
No.
I think you should just, Charlotte, be ready with Paxlovid, right? Just have a plan.
Well, she's over 75. So she would be elderly or something or other, I believe.
So you could get the booster, or you could just not and have Paxlovid and do well. That's the key, right? As long as it's available where you are. If I remember, Charlotte, you're in Florida, so should be okay.
She's boosted as much as she could. She's fine.
Yeah. A lot of chatter tonight. So my vaccinated ex-husband who got COVID was allergic to Paxlovid. Took 3 weeks to get better, but he's okay. Says he's got brain fog. Well, I can understand. I told Amy I had brain fog on Monday, right? Or Sunday. I felt a little foggy.
Monday, Sunday, Tuesday.
But now
I
I'm
didn't
okay.
speak to you yesterday. Sunday and Monday you say, I don't feel like Vinny. It's like, oh, really? What does Vinny feel like?
Yeah, it's lifted by now. And I was taking the subway to the lecture today, and I didn't feel normal. But then I get to the room.
You didn't feel normal?
No.
You didn't feel normal?
It's full of excited students. I get introduced. I get into it, and everything is fine, you know? Everything is fine. Headed to New York City soon. Is Resdora your go-to? I don't know if you can get into it anymore. You could try.
You have to make reservation now. But yeah, it's go-to restaurant. Excellent restaurant.
Preschool viruses have ravaged our house. Wow, hand, foot, and mouth. Yes. By far, HFMD hit us the worst. Any unique insight to offer on Coxsackie virus?
It's my baby.
You can't do anything about it, right?
Not yet, but we're working. We're working hard.
Is injecting BCG in a superficial tumor of the bladder effective at treating it?
That's what they do. They don't inject it into the superficial bladder, into this tumor. They inject it into the lumen of the bladder, and it stimulates an innate immune response. And then that contracts the tumor.
Thanks, Miter, for your support. Enjoy your Spike t-shirt.
Everybody needs a Spike t-shirt.
Aren't home tests showing to be very inaccurate? I've had friends test negative, positive, then negative. There can be some confusion, yes. Mine was positive, and that was the end of it. Maybe I should go test again and see when I'm negative, Amy. What do you think? Should I do?
Sure, fine. Let's do the experiment.
Someone here advised if I should get one more mRNA booster after having had the J&J as primary and Moderna booster since 6 months later. It's been a year since the booster. Should she get a third then, Amy? What do you think?
No.
No, I don't think so. Did you ever get good coffee here in Hawaii? I never went to explore Hawaii coffee. No, sorry about that. Mixed work and pleasure, so it's not ever a good thing. And we can never have enough glitter in the world, Amy. Did you know that?
Yes, you need more glitter. Everybody needs glitter.
Are the only one with cool shoes at the FDA?
No, there was a guy who was doing stuff. And he had cool shoes. Well, his was cool sneakers. But he was walking behind me down the hall when I came out of the freezer farm. And he goes, "Girl with purple shoes." And I was like, yeah, that's me. But he had cool sneakers on.
Why get Paxlovid? Michael, as I said, I just asked Daniel. He said to do it, so I did it. That's it. I would have liked to try not doing it, but I didn't. So, there you go. No one talks about J&J vaccine. Yeah, it's kind of been marginalized, right?
Yes.
Unfortunately. Or probably it's a good thing. It wasn't so good, right?
It was fine. It was a good vaccine.
Don't know if I'm fully vaccinated and considered boosted with one J&J and one mRNA. I think we just answered you, but I think you should get a second mRNA, okay? Do that. Do you have long hair, Amy?
Yes.
Could you debunk the lab leak theory? Yeah, it's still running strong out there. Well,
listen to Eddie Holmes.
We did a wonderful episode with Eddie Holmes where he pretty much debunked it. So let's just go there. But yeah, there's nothing to the lab leak hypothesis. It's not even a hypothesis. There's no data in support of it, whereas natural origins, plenty of
Since when
support.
do you need data to have a hypothesis? You just need to make some stupid statement. Look at our government. They make tons of stupid statements. No hypothesis, no data. Understand.
What is this black cat in D.C.? What does that mean, Amy? Do you know?
I don't know.
Is that a place to go?
We can look it up. Well, look it up.
Oh, Vista wants to know who's the dancing people behind you. Keith Haring, right?
Keith Haring. Yes, Black Cat is on is on 14th Street in DC.
Cool.
It's
Well,
a
maybe,
music venue.
Carolina,
We
you wanna
feature, yeah, it's
wanna go
cool.
with Carolina?
Sure, for sure.
Well, Carolina, next time I'm in DC, we could go with Amy. How about that?
Yeah, it's cool. They feature the best in local, national, and international independent. And I don't know. I clicked on the link. It didn't say anything else.
No worries.
Yeah, international and independent alternative music. So there's Cake and Machine
Good.
Girl. Didn't you like Cake, or didn't Nadia like Cake or something?
I don't remember. I'd have to look. Okay, Doreen, if we do Chicago, we'll let you know. We'll be there. And we're wrapping this up soon.
Yeah, it's time to go.
Who's in Miami? Are you? Oh, Silvio Pina. I'm going to be there for other purposes. So if you want to hang out, Vincent at microbe.tv. How long after testing you no longer have to take measures? I think 5 days with no symptoms or fever, for example, and you're good to go. I have not until today been out and about. How do I explain to a COVID-positive older person they need to take Paxlovid if they have mild or no symptoms? Because since they're older, they could get severely ill, and by then it's too late to take Paxlovid, so you might as well take it ahead of time. I think that's the way to explain it. Hi, Vincent. I noticed you coughing on a recent TWIV. Yeah, so that was Friday. I was coughing, and that's the next day I tested positive. Yeah. Yep. Fortunately, there's nobody at the incubator. And I wear masks on the train. All right, folks, we're going to wrap this up. I actually have Daniel Griffin's clinical update to record now in 15 minutes. He's going away tomorrow, so we have to
where's he
record
going?
tonight. I think he's going to Uganda.
Oh, yeah, he's going to Uganda for the Ebola thing. Yeah, that's
The
true.
Ebola what? The outbreak?
Yeah.
Am I isolating from my dogs? Yeah, I'm taking care not to touch them. Yeah,
You've been banished from the main sanctuary of the household. Let's just be real.
I've been wearing a mask here, and I mostly am in my I'm in my office all day. I come down here and stay here all day. Yeah.
Well, now you go to the incubator. Tomorrow you go into
today
the incubator.
I went to the incubator.
Friday I go into the incubator. Why aren't you going tomorrow?
I'm going tomorrow. Yeah, don't worry.
What happened to the sofa, by the way? Did you move it out of the hallway?
It was very heavy. It was not easy to move in.
Sorry.
But has to be assembled now.
Assembled? Okay.
Has to be put together.
Discuss.
Your warm-up is my workout. That's really interesting. What did we say, Amy? I've already forgotten. Your cynicism is my reality, right? Well, someone's going to write that down, right?
Your cynicism is my realism.
Your cynicism is my realism.
Realism.
What viruses can self-replicate? Well, not anymore.
Viroids.
Viroids, yes. Viroids in plants, they encode nothing, and they can self-replicate. Well, actually, they're...
Okay, you're going to be late for Daniel. Just wrap this up.
They're copied by host enzymes, but they encode nothing. So they're probably relics of this world where there were.
Plus, you got the ribozyme.
Yep. Thanks, Miter, for your contribution to science communication. And thanks again. Oh, another contribution. Really appreciate it.
Okay, Daniel's going to be mad if you're late.
Oh, yeah. Bring Dixon to a Q&A. Oh, my goodness. There's no way Dr. Rosenfeld is single. She is.
Yes, I'm single.
Enjoyed the Prion Twiv. I hope you liked that. That was great. I enjoyed it too. Come to Taos. Been there many times. We'll let you know if we end up going there. And let's see, anyone else? Oh, I got 10 Spike t-shirts. That's great, Visto. Thank you so much for your support. Really appreciate it. And Virag got one in October for his kid. Excellent. I love it. I love it. It's a good T-shirt. Makes everyone feel good. All right. I think that'll do it, Amy, for another corner of the virological internet. I want to thank our moderators. Les, I didn't see Vanity. Did you see Vanity? She showed up early, but she might have left. And we had Frank. We had Steph. Thank you so much for...
You forgot Les. You had
Les,
Les,
I said Les.
Steph, Frank, and Vanity. You had 4.
Thank you all for coming here and moderating. Thank you all 400 some of you, for coming again and listening to Amy and I talk about viruses and chatting among yourselves. We'll be back next Wednesday, 8 p.m. Eastern Time. Dr. Rosenfeld, thank you for joining me. I appreciate it as always.
Okay, thank you. Gotta go.
Thanks,
You
everybody.
gotta go.
Good night. See you next time.